The three-dimensional method for back pain. Hey everybody, this is Mike Erlob with another episode of Power Your Life. I am so super excited to be here with you guys today. I just want to thank everybody for joining me. Today is going to be a very special episode because we are going to talk about the three-dimensional method for back pain. Three, however you want to look at it. The three-dimensional method for back pain, okay? So before we get into that, I want to take some time. I want to tell you about a recent client of mine, okay? And we're just going to call him Jason, not his real name, but I want to protect his identity. So Jason came to me a while back with this very intense back pain, very intense lower back pain, and it had been there for over 6 months. And the thing is that Jason, he was an electrician, and he had to do a lot of bending and twisting, a lot of wire work, and he couldn't work because of his back pain. So he actually had been out of work for 6 months. And, he was really, he was worried. And he told me when I first saw him that he didn't think he was going to be able to return to work. He was really worried about that. And the other problem he was having was that, he had these home projects. He was working on this home remodeling project and he couldn't finish it. And so his wife wasn't really happy with him in that respect either. And, Jason was, to say the least, he was very frustrated. He was very worried. And to top that off, the guy was in pain and he was hurting. And it was just painted all over his face. You could just see that. And, my heart just goes out to him, and you feel so bad when somebody comes to you like that. And you just want to take that pain away. You just want to help them. So Jason, he had actually been to another therapy clinic for quite a few numerous visits before he came to see me, and he didn't get any relief. And I talked with Jason. We went over what he was doing, and he just wasn't feeling that it was helping. And so he is at that point where, you guys have been there. We've tried different things, and you're like, man, nothing's going to fix me. And that's what he thought. Jason thought. He didn't think anything could help him at all. And he was really, he was just at the end of his rope. And so when I met with him and I sat down, we talked for a couple minutes, and I started taking a look at his back issue. I could tell right away. I knew right away what was going on. And, as I checked him out, the one thing I asked him was, I asked him, did anyone ever address his psoas muscle? And, or that's the hip, remember the hip flexor muscle. That was a muscle in the front of the front of the hip area. And I remember Jason, he looked at me when I said psoas, kind of like everybody else does. And he just looked at me this perplexed, like this kind of like, what on earth are you talking about? He's like, what is that? And so, I went and I actually pushed in on the psoas muscle, and I pushed in on his lower stomach. And I can't tell you, I'll never forget. He literally almost went through the roof. It was so tender when he pushed on that. He was just ready to jump off the table. And that's what we see so much, is that psoas muscle just gets so hyperactive, and it's all knotted up, and it just really, really hurts. And that pulls and creates that compression on the spine, and it just sends the pain, it makes your pain just so much worse. And he confirmed with me. He's like, no, nobody's ever pushed in on my stomach in therapy. And it was never addressed. And, the other key point with him is not only was that psoas a problem, but his hips were so stiff that, how you sit like in a figure 4 position where you take your, if you want to take your foot and put it on top of your knee, that figure 4, he had a really hard time doing that. His hips were so limited in their mobility. And, that's so common that I see with people with back pain is their psoas muscles are super tight or hyperactive. Their hips are really tight. And those are direct links that increase the compression and the issues on the back. And that was the missing link for Jason. And so I started him on the three-dimensional method. And he noticed, I mean, he did. When he walked out of the clinic that day, he noticed some relief on that first session. He actually told me, he said, I can't believe, he said, I actually, I'm not all the way better, but he said, I can feel a definite difference. And I ended up seeing him over the next 6 weeks after that. And, we addressed his problem areas using this three-dimensional method. And he was pain-free and back to work at those end of those 6 weeks. So the reason I'm telling you about that is because this isn't just a method that, we came up with. I mean, this is something that I've been using in my practice for a long time. This is something that has been used and been proven again and again. So what exactly is this three-dimensional method that I'm talking about? This method is specifically, it is for those that they're struggling. They want a true fix, okay? And they don't want to use any pills, injections, or surgery. And they want to avoid those frequent or expensive trips to the doctor. Okay, so that's who it's for. Now, what this method does is it rapidly, let me think of how the words to use. It rapidly reshapes and rejuvenates the spine. Okay, so it doesn't just alleviate, yes, alleviates the pain, but it actually remodels and changes the spine to help normalize the activity of the hip flexors, of the psoas muscle. It fortifies the activity and the strength of the gluteal muscles and the core. And, the result is, you become more confident, energetic, because you're not in pain anymore. And it's remodeling and reshaping the spine so it's healthier and not compressed anymore. And I mean, that's the key thing. Now, what I do is I actually balance the musculoskeletal system. And essentially, we're using these unique movements, stretching and exercise methods, and we're using a unique pressure point release technique, okay? And what it does is it's all natural, it's fast acting. And so the movements, the stretching and exercise methods, and the pressure point treatments, those are the key portions of the three-dimensional. And what I see is that many of the clients, they're going to see that pain decrease in that first session. And they're going to start feeling better within 2 to 3 sessions after that. They're going to really start noticing dramatic improvements in how they move and how they can get through the night, sleeping at night, and the whole 9 yards. The aim of this program, and I tell this to all of my patients, is, and I'm just trying to really want to explain how this works, is my aim, my job is to work myself out of a job. Okay, so it is to teach each and every one of my clients how to take care of this problem on their own. Okay, I don't want somebody to be dependent on me. I want them to be able to fix this problem on their own. And that's the aim of this program, is to get you doing the program on your own. And that it only takes at home, this program only takes 8 to 10 minutes a day to fix your body and to have that lifelong spine health. Now, here's how it works. So the first thing that this three-dimensional program does is it stops inflammation. So the method, it uniquely stops inflammation in 3 ways. First of all, it decreases inflammation mechanically. Okay, so it alleviates by getting the muscles to release, and in other words, shutting off the hyperactive muscles and turning on the muscles that are underactive, in which most back cases it would be the psoas being hyperactive and the gluteals being underactive. When you get those muscles to turn off and turn on, mechanically there's less compression. It decreases the compression on the spine, which mechanically decreases that inflammation. It changes chemically, because when a muscle is hypertonic, meaning it's all contracted up, and it releases, it loosens, you get increased blood flow into that area. You get increased blood flow into your back, and blood flow carries the nutrients that the spine needs to heal and flush out that inflammation. then neurologically, now we're shutting off those pain impulses. It's literally like you find the off switch in your body to turn off the pain impulses. And it balances those muscles in the joints for smooth motion, and it balances the body chemistry and the nerve impulses. So the second thing is it stops pain. So by normalizing that muscle activity, by stretching out and deactivating those tight dysfunctional muscles, and then resetting the nerve impulses by activating the proper muscles, it'll reduce that pain almost immediately. And that's why clients will feel better right away on that first session. And then the third thing is it improves the strength and flexibility. So what we're doing is we're instructing you in the unique movements and exercises that are custom for your condition and your body type. And then what that does is that brings in balance and brings in harmony to your body and to your spine for long-lasting relief. That's why it continues to work. So, if you want to know more about this, I would recommend that you get a copy of my free ebook, The 5 Best Kept Secrets to Fast Back Pain Relief. And you can get a copy of this free ebook just by sending us a Facebook message. Or you can email me at mike@flex-pt.com. Just request the back pain book, and we'll get that sent out to you right away. Because it has a lot of very helpful, valuable information that can help you along your way of getting better and fixing your back for life. So hey, that's really all I have for this time. I want you to enjoy the rest of your week, and until next time, stay healthy and keep moving forward.